Want to bring in my good friend, Dr. Joe Congini, Sports Medicine Center at Akron Children's Hospital. Joe, what about this fracture now in the shoulder of Baker Mayfield? We've talked about the torn labrum and certainly the difficulties there and such, but now we have this fracture onto this.
Well, Ray, good morning. Hope all's going well for you this week. And again, everybody's commenting on this. Everybody is putting in their 2 cents. Very few people have seen his X-ray or his MRI that shows this. But what happens, this is the next step, is the ball on the golf tee. When it slips off, that cartilage can tear. That's the labrum. And then it's a lot more prone to slipping off again. And the edges of this little golf tee that the ball sits on, it's not really much of a socket, as I told you the last few weeks, is when the ball slips off very hard again, it often will knock off a small piece of the golf tee or the socket. And usually it's a fairly small piece. In his case, they say the humerus, so it would be the golf tee. And we usually will have a very small little fracture. Sometimes we call it an avulsion fracture. But if they were talking about a big fracture further down at the neck, with the stabilizing part of the shoulder, nobody would even be talking about him playing, and there would be no question about him needing to have the surgery. So I'm assuming that he, when the ball was slipping out, probably got one of these smaller fractures that occur around the end of the golf tee now because he doesn't have that cartilage there to protect it. And these are not at all uncommon. A lot of times they're so hard to see even on a plain X-ray, and until you get an MRI. He, if I'm not mistaken, has had a couple of MRIs in the last couple of weeks. So you pick up a lot of these smaller, more subtle kinds of things, and I think they probably picked up a small fracture of the humerus.
Great. Dr. Joe Congini is with us, Sports Medicine Center, Akron Children's Hospital. So we'll wait and see what Baker's status will be for the Steelers game Sunday at 1 o'clock. Joe, what else do you have on your list today, my friend?
I wanted to move down to the younger athletes as we see so frequently at Children's Hospital. And often what people say to you is, oh, my gosh, what makes young athletes different than the high school kids, the college kids? And we often just answer, oh, it's the growth plates, or they're going through growth. And a lot of people don't know what growth plates are. So I was going to talk about growth plates and the very, very, very common in our office growth plate fractures that we see. The growth plate is an active part of growing of the bone on the end of all the long bones that we have in the body. But it's made of cartilage. It's kind of a rubbery or flexible material, this growth plate is. It's not the hard, strong bone yet. And during the years of 13, 14, 15, 16, as you grow, the more and more of it becomes harder. And by the age of 15 or 16 for girls, 17 or 18 for boys, there's no more of these growth plates. They're pretty much a finished product. But during the ages before that, so junior high, even grade school, kids get these injuries. It's kind of like the rubbery, cartilage even in your nose. I explain it to parents and grandparents in my office. It's kind of like wet cement. It's not finished hardening yet. And so these areas break, or they get crushed, or they get pulled off, or they buckle. And they're really painful for kids. They're usually at the end of the bone. And it's very often easy for parents to say, oh, my gosh, that's a sprain, that's a strain, that's a tendon injury. No, kids don't get strains and sprains. That's why we don't talk about ligament injuries under age 16 very frequently, or 15, because more commonly they will injure the weak link in the chain, and the weak link in the chain is the growth plate. Now, most of these growth plate fractures are pretty routine, and we look at them on X-ray, and that's enough. We don't usually have to get fancy MRIs or CAT scans on them, but some of them are complex. Maybe 10% or 15% turn out to be complex, or what we call unstable, which means they won't heal on their own. 80% heal very well in a cast, 80 or 85%. So it's kind of almost humorous. kind of funny to see the fracture clinic on Monday morning in the summer or any time of year. The kids line up outside my partner, the orthopedist offices. We're so blessed at Akron Children's. We have 10 orthopedists that specialize in kids. With some of these fractures, because they are tricky, even a lot of the adult orthopedic doctors don't like to necessarily fix them. And I think they're pretty happy that we have 10 pediatric orthopedists in town that are available, because if they don't get fixed right, the bone may end up twisted or curved, or one side longer than the other, sometimes significantly longer than the other, and they have a really bad look cosmetically, and they really can affect how kids run or throw or do things. They can get injured both by trauma, by falling on the growth plate, or from overloading it, like pitching too much or throwing too much. And so if they heal poorly, they sometimes then need surgery. So it's real important that they're treated appropriately up front. And these people, the pediatric orthopedists, are just great people to have in town. We don't want our kids to get one of those complications of a twisted bone or a curved bone or a leg length discrepancy. One leg is much longer than the other because of the fracture. So we're really lucky to have those people around. And when kids have, in that age range, again, remember, for girls less than 16, for boys less than 18, especially junior high and high school, pain in one particular area, it's not usually a ligament or a tendon. It's most commonly a growth plate, and it needs an X-ray, and it needs the appropriate people to fix it so that that bone will straighten out, grow normally. They heal very nicely in 4 to 6 weeks, usually a short period of time, and that is when they're treated properly. So another great reason to be thankful and fortunate to have a children's hospital around is having 10 right on my floor, 10 pediatric orthopedists. They go out to all these, to Mansfield, and they go out to Youngstown, and they go out to a lot of areas around, because their specialty is so important to make sure that we fix these fractures appropriately.
Great stuff this morning. Great medical corridor in Akron, and Akron Children's Hospital certainly a big part of that. Thank you, Joe. Appreciate the time, my friend. We'll catch up with you again next Wednesday.
Thanks, Ray. Enjoy the rest of your week, okay?
You too, my friend. Dr. Joe Congini, Akron Children's Hospital, with us this morning.